MaineHealth's getting $1.1 million in grant funding to research the effect of PFAS exposure to children. Money's coming from the National Institutes of Health. The grant will fund 5 years of study. Officials say it will help MaineHealth expand environmental health research while supporting the development of the next generation of clinician scientists studying environmental health risks. The lead investigator says this research is badly needed.
Maine faces a really disproportionate burden of environmental hazards to things like PFAS, naturally occurring arsenic, radon, and wood stoves. Primarily the counties of Kennebec, Somerset, Waldo, and Penobscot. That community has experienced a PFAS contamination in the setting of biosolids or treated sewage sludge that was spread as fertilizer on farmland.
MaineHealth will also look at how exposure to PFAS during childhood may influence obesity, diabetes risk, and cardiovascular health in later life.